My name is Dr. Kametz from the Gohl Clinic of Chiropractic. Our mission is to help adults and children reach their potential in life by keeping them off of drugs and out of surgery through specific scientific chiropractic care. Today I want to go over a case of a 30-year-old female that came into the office, and her major complaint was low back pain and left leg numbness. She also had left arm numbness. She described the severity as a 7 to a 10 out of 10 as far as the pain level. And all this happened after she had been hit by a car. Not her car getting hit, it was actually her getting hit personally by a car. As I went through the exam, when I found pressure on the nerves, I was also able to associate other symptoms that I asked about that she indeed have. She had carpal tunnel in both left and right hands, also irregular periods, and constant sinus infections. So I want to go over a pre and post X-ray here to show you exactly what happens when we adjust the spine. By adjusting the spine, it's getting the pressure off the nerve to correct the subluxation and allowing the body to function more normally. When that happens, structure, the spine will start to change, as will the function of the nervous system in the body overall. So let me show you what happened here. I'd like to address this issue first globally, the entire spine, what's going on, and then I'll show you section by section of it where some of the issues are. When we take a look at the low back here, there's a problem here at the fifth lumbar that is shifted backwards by 4 millimeters, and that's starting to pinch off that nerve. And what that is, it's the posterior movement of that segment that does that. Not only that, there's a 15-degree wedge there, right, pinching off that nerve. As we go up the spine, what we'll see is in the cervical area, you can see it's a complete reversal of the cervical curve here. About the only thing that she does have going for her up here is the discs appear pretty well undegenerated, which is good because we can work with that material. So I'm going to show you now intersegmentally a little bit more in detail exactly what's happening at these segments. We're going to have these pictures available online for you to take a look at, but you could clearly see right here the major problem in the low back is this fifth lumbar that's shifted backwards by 4 millimeters, and that's what's pinching off the nerve here. This is what's causing her low back pain. It is also restricting a nerve impulse into the ovaries, and if you get a restricted nerve impulse into the ovaries over time, they will have difficulty making the right amounts of estrogen, and of course that's going to affect the periods. But that's the major issue here in the low back. I want to show you the neck because this one's a bit more significant up here. This is actually very significant in here. Because of the subluxation here, what was happening is her body was compensating by completely reversing the curve of that neck. So this is very serious on her. This area innervates mostly the ear, nose, throat, sinus area, so her sinus conditions were being affected by this, but also the lower cervical innervates the brachial plexus, and that's what goes down into the arm, and that's affecting that carpal tunnel syndrome. So let me show you what happens on the post X-ray here. Once again, I'm going to address this issue globally, and then we'll talk a little bit more about intersegmentally. But once we started correcting her, that 4 millimeter posterior segment went down to 2, so there was a 50% reduction in the posterior movement of the vertebrae. That's allowing a more normal nerve impulse to get through. Also, the wedging went from 15 degrees to 9 degrees, so that's pretty significant right there. Let's go up top to show you what's happening up at the neck. Up in the neck, very significant changes here too. The first thing that you'll see is this has started straightening out from a complete reversal of that curve, really affecting that nervous system. The body was in a tremendous amount of compensation. Now it's started to normalize by straightening out. That is still not corrected yet, but a very significant change for her. I'm going to show you this more up close here so you can get a good look at this. Here's a close-up of the intersegmental change. Once again, these will be posted. The picture of these will be posted at the link on the top. But a very significant change down here at the fifth lumbar. I want to show you the neck because that's even more significant to her. There's a significant amount of change on the cervical area here. What was happening was her body was, because there was so much nerve pressure and interference to the nervous system, her body had completely compensated by reversing the cervical curve here, and that's very significant. This is a before and this is the after right here. On the after, it is not fully corrected. It takes some time, but clearly from a complete reversed curve, that is straightened out, and that is on the way to changing this, okay? Absolute huge change in her life, okay? So as we started correcting the subluxation, here are some of these symptomatic changes that she noted too. Significant improvement with the low back pain, the left arm numbing, the carpal tunnel in both the right hand and left hand. Significant improvement on that. Improvement on the irregular periods. And she did not mention any more sinus issues after that. If you're interested in learning more about our clinic, you can check us out at gohlclinic.com. Also, you can follow us on Facebook at facebook.com/gohlclinic, or you can subscribe to our YouTube channel below. Thank you, and I hope you enjoyed this video.